I'm taping this episode of Gynocurious on January 6, 2025. Happy New Year to everyone out there. As most of you remember, on December 4th, 2024, Brian Thompson, the UnitedHealthcare CEO, was shot and killed in New York City. I've been thinking so much about this event, and also curious how others have responded to the killing. Almost unanimously, folks I speak to are saying they don't advocate violence or killing in any situation. But yet, quote, they understand what might have motivated the young man who is accused of the killing. There has been a tremendous amount of press about the charges and the background of Luigi Mangione, and yet so little about the problem with healthcare and the reasons so many clinicians and patients, perhaps like Mangione, who are extremely frustrated with the current system. Andrew Whitty, the United Health Group CEO, parent company of UnitedHealthcare, said, quote, "We know the health system does not work as well as it should, and we understand people's frustrations with it. No one would design a system like the one we have, and no one did. It's a patchwork built over decades." So there's a lot to unpack in that statement, and I have certainly a lot of responses to it. But Further, I've been thinking about this killing. And, you know, the killing has been viewed as a violent expression of widespread anger at the insurance industry and healthcare in general. Yet again, there's been such a glaring lack of coverage about how the insurance industry and the business of medicine has contributed to the vast systemic challenges most of us face as both clinicians and as patients. Welcome to Gynocurious. I'm your host and creator, Dr. Amy Novatt. From both sides of the speculum, we're here to investigate what it means to be a healer and to be healed. Please follow the show, give us 5 stars right now while you're listening, and share with friends and family. And if you have any comments for me or the show, please send them to comments@radiofreerhiniecliff.org. So today I am thrilled to have Dr. Amy Cocina here in the studio with me. And we're here to speak about our mutual experiences working in the world of medicine, and particularly in large medical systems or corporate medicine, and how the insurance industry affected our day-to-day work. Amy worked for many years as a primary care physician at Rosenberg Primary Care, a part of the large Novatt health system. She left Novatt early in 2024 to work for SUNY New Paltz, where she is now the Director of Student Health Services. She did her medical school training and residency at Mount Sinai Medical Center in Manhattan, but also has a master's in molecular biology from Princeton University. Welcome, Amy.
Thank you for having me.
It's such a pleasure. I haven't seen you in quite a while. We've both been kind of shifting where we are and what we're doing, so it's so nice to see you.
It is. It's a special opportunity for these morphing career paths that
I
we've
know,
had.
Exactly. I love that. So that's a great segue to my first question, always on Gynocurious, is kind of like, why medicine? Your professional arc. Can you tell us a little bit about how you went from being a smart young woman to a smart clinician?
I mean, it was never a straight path for me. It was this strange collection of life experiences that probably started with my local library.
Ooh, tell us.
You know, I'm such a big reader, but when I was I think it was 5th grade, I made a bet with my parents that I wasn't going to watch TV for a year. And I spent the entire year just reading, and I fell in love with reading. And what I realized was it was the best way that I could experience what life was like in someone else's shoes. And what I learned about myself was that I loved learning about other people's lives. And I was so mesmerized by what people of all makes and backgrounds and cultures and everything, just how they lived and what they experienced. And I think over the course of time, different life experiences drove me to realize I wanted to help people live their best lovely life. So that's...
I often hear this kind of organic crystallization of where we come to professionally. And it's so lovely because it is often kind of this merging of what feel initially as disparate events or ways of feeling about the world that all of a sudden morph, your word, into this way of life that hopefully has brought you great joy and challenge and learning.
All of those things,
Yeah.
right? It's such a privilege to be a physician.
Yes.
It's such hard work. The path to get there is challenging and exhausting. But what a privilege that people let you into this special part of their life and bestow their most vulnerable moments on you. And it's really a beautiful thing to have experienced.
Yeah, it really is. And I think that's one of the reasons that I feel compelled to talk about the hardship of corporate medicine today. Because for me, I've loved my career. I just love it. It's I often say it's kind of my office is where I feel most at home, truly, where I feel most genuinely in my own skin and in my own heart and in my organs, if you will.
I get that.
But then I started to work for a very large company that I no longer work for. And it started kind of eating away at that joy. And it wasn't as if, in my office, when I was with a patient in my office, my exam room, if you will, I was able to protect that joy. But the minute I walked out, there was constant eroding of it. And so I kind of want to talk about that. But let's kind of move backwards because you've moved to SUNY New Paltz. And I think SUNY has been a part of your life a couple of times now, right?
Yeah, I was fortunate that SUNY Geneseo actually took a chance on me. When I was
There should be some music behind us right now.
And I think without, that educational opportunity, it wouldn't have then launched. And my amazing professors there and, just different ways of life that you're exposed to when you're a college student. And then I think without that educational opportunity, I couldn't have then gone to get a master's. And then actually, when I was in college, my mom developed breast cancer, which she ultimately survived. But it sort of, again, sort of pushed me on that path of, I love people. I love being part of their lives. Maybe this is how I want to help them. And I went to graduate school to try to cure cancer, right? I was, working on these projects, but I didn't have that connection that I really felt that I needed in my soul. And then I, had met my husband. Well, he wasn't my husband at the time, but, he became my husband. And he really encouraged me to follow my passion and kind of move on and apply to medical school and begin that different journey. So I've been fortunate to have people that have been on my side through this.
Great.
Yeah.
So now you've returned to SUNY. And how has that been? Because that's also a large institution. But I suspect it's different from Novatt, which we're gonna. I guess let me just say now what Novatt is it's a large organization that includes 7 hospitals, employs about 2,600 doctors. It's about to merge with Northwell, which is even a larger system with about 12,000 physicians. So in contrast, how has SUNY New Paltz been, as again, a larger institution, but how has it been for the day-to-day taking care of young adults?
I mean, I think it's fantastic in so many different ways. So I loved what you said earlier about the passion for practicing medicine and how you could put, when you close the door and you're in your exam room with that patient, your passion and your love of medicine can be revealed. But as soon as you open the door, those pressures come back. And I really felt the same way that you stated that. One of the nice differences in working at SUNY New Paltz is that I don't have to deal with insurance companies anymore.
Oh my gosh, that's fantastic. So, because I guess students come in with their medical insurance, or who deals with that?
Nothing.
Oh my gosh, it's like, what would you call that? Nirvana.
It really feels like that. I can just be a doctor and no one's breathing down my neck to, make more money for them. The students pay a fee and all of the services that we provide on site. So as soon as something leaves the site, it has to go through their insurance, but all the counseling, all the exams, everything that we do, it's all free. And, I think these students have a very special opportunity to just receive care without the burden of fighting a healthcare system.
Yeah.
And the practitioners can practice care without the burden of a corporate model.
Fantastic.
It's wonderful.
And these are young people who are kind of just learning how to take care of their bodies and their minds. And for many, just learning about sex and sexuality. So it feels like such a gift that they're in this environment in which you're not pressured and you can be really expansive with them, can't you?
It's such a special moment in their lives. So, you know, these students are coming in, and like you said, there's no pressure. They can come in with their questions as big or as small as they are. And you can, you know, when you're in college, you're not just learning about your different courses. You're learning how to make decisions about how you're going to live the rest of your life. And some of this involves like what kind of food choices, what kind of exercise choices, what kind of health choices are you making? And so what I've found, and I've only been there a short time, but what I've found is this wonderful opportunity to influence their health decision making and hopefully guide them into making healthy choices for the future.
Yeah, I mean, this is what we call preventive medicine or preventive care, excuse me. In contrast, when you were working with mostly older adults in your primary care office, how is it different? Are adults more stubborn?
I would say that's fair. As we age, we're a bit less malleable. But I think it's more than that, right? Like, you know, people do get set in their ways. And in the corporate model, I found it increasingly more and more difficult to have those important conversations with people about how they were making health choices at home. And when you're sort of pressured to see a certain number of people a day or how long you can spend with them, because I think that's something that a lot of patients don't realize is that their doctor gets a very small amount of time with them. So they may have 50 questions, but there's 50 patients after them waiting to be seen, you know? And so I'm sure they're, you know, or I assume that most physicians want to answer all those questions, but there's just not the physical time.
Yeah, let's break that down a little bit because I know, I mean, listen, there are plenty of people out there who know doctors are not spending time with patients. Mm. But let's really talk that out. Mm. What happened when you were at Novatt, for example? What were you told? Were you told you had to see patients in so many minutes? Were you told you had to see a certain number of patients? Were you told every day how much money you weren't making? How did it get translated or communicated to you that you needed to see more?
I mean, I think there's a variety of modes of communication of these expectations. And in some ways, I think some administrators' roles are there to sort of put the pressure on you to see the patients in a certain number of minutes. In primary care, usually that's 15. Some visits are 30. But in general, when you schedule a follow-up with your doctor, it's a 15-minute visit. And then it kind of comes at you. It's subtle, right? It's almost like this pressure in that you could maybe say no to it, but the pressure is so like, it's just unceasing. And you're constantly hearing about how many, you know, how long you had your visit, how many patients were seen. And
you know what Optum used to do?
Oof.
So it was brilliant of them, quite frankly. You take a cohort of folks who are competitive by nature. Physicians are competitive folks.
Totally.
They've been raised in a college setting, medical school setting, residency setting, where it's always about trying to be your best, but also you're competing against others. Mm. So on a very regular basis, they would publish the numbers that people were making in each department. So you not only saw who is against you in your own department, but other departments in terms of RVUs, money made, et cetera, et cetera. It was so insidious. So you'd look and you'd think, oh, I'm doing my best. And then you see someone right above you saw a few more patients or had RVUs. These are units that you are generated by seeing patients. It's just a way of tabulating. Oh, I'll have to just do some more. It was terrible.
And it's this strange, somewhat passive pressure.
Yes.
So it's very insidious. Yeah. Like, you know, and you want to be a good employee. You want to please people, right? We're people pleasers.
We are. Yep.
And so then you might then you kind of internalize it and feel bad, like, oh my gosh, should I have fit more people in? But then there's all this other stuff that comes after hours that you need to do too.
Yeah, let's talk about that. So what did your day look like? You'd see patients, and then, when would you do your email? When would you do your charts? When would you fill out your notes?
Right. So all that happens after you're done seeing patients. And there's this, minuscule amount of administrative time that you get, right, to do your charts and check your labs and call people because there's something on their CAT scan that you don't like and they need to come in and see you. There's a myriad of different things that you might need to do, but all that happens at home.
And I want to remind people, at least where I worked, those hours spent doing that work were not considered patient hours. So I was not, if I wasn't filling my patient hours, seeing patients, even though I might have spent 3 or 4 hours doing this other work, didn't matter.
Exactly. You're not compensated for that time. And in primary care, and I can't speak to OBGYN, but, it was reaching the point where this stuff that you're doing after hours is almost the same amount of time that you're spending seeing patients. And I think some of that's a function of, over years, not only has healthcare cost been increasing, but the number of denials by these insurance companies is also increasing. And so you have this patient load and it feels like year after year, oh, I can't, why can't I get this done for them? I've got to, and if you truly care about your patients, you're going to fight the insurance company. And with, apparently somewhere between 1 in 10 and 1 in 5 insurance claims are denied in America. And so you're like, but my patient really needs this. I got to fight for it. But all that fighting that you're doing is at home. It's in your pajama time. It drives me crazy. And then every year, it's more and more and more of this battle that you need to do to get your patients the care that you feel they deserve.
If the mantra of these insurance companies is to deny initially and perhaps deny second time around, for all of us, whether we're clinicians or patients, this is time spent not getting diagnostic testing done, not getting the care you might need. And from a clinician point of view, it's time spent, kind of spinning your wheels, not able to pursue healing in a way that you think is fit and you've been trained to do.
Right.
So it's enormously frustrating. And remember, when we call insurance companies, just to let everyone know out there, we don't get directly to the doctor. You have to press 9 for this and 3 for that. And it's just like every other phone call we make in today's, world.
Minimum of 20 minutes per phone call.
Yeah.
To get someone to evaluate whatever it is that you're trying to argue.
Yeah.
It's a lot of time.
It's a lot of time. And, I don't want to be naive. I think that there has to be some way in which we limit costs. And there has to be some way in which we figure out how to provide good, excellent care in this country without spending the kind of money we spend. I mean, the amount we spend in our GDP for healthcare is obscene. And as I've said way too many times on Gynocurious, it's not like we have the best medical care in the world. We do not.
No, in fact, we're the bottom of the top 10 high-earning nations for healthcare outcomes, and we spend almost twice as much as other countries on healthcare. It's about $14,000 an American every year for healthcare. And we just don't have the outcomes to back up that kind of spending.
That's right. And then what about on the individual level? We all buy these medical insurance policies that we think, okay, we'll cover everything. And of course, they rarely do.
Right.
And they just get more and more expensive. So the system, so many people will ask me, okay, so Dr. Novatt, how are we going to fix the system? And I at this point, I have kind of a standard answer. And I don't know, I'd love your thoughts about it. I think it has to implode. I think really, because I don't know any other way. It's like, what Andrew Whitty said, oh, we didn't really make it this way. It's patchwork. Well, sorry, bullshit. Let's step up and say, this is how you fix it. And there are many very brilliant people who have made recommendations, but There's too much money to be made.
Too much money. Money. Yeah.
Yeah.
It's, right now people estimate that there's 10 administrators for every physician in the American healthcare system.
Whoa. I didn't know that statistic.
It's
wow.
a terrible statistic. And I remember at one point, because I want to make sure that all my patients of age get their colonoscopy or whatever cancer screening they might need. I remember like someone coming in and being like, so, you really got to get that colonoscopy data in the system. And I'm like, okay, well, I know that, but I didn't do the colonoscopy. So I need someone else to send me the report so I can upload it into your electronic medical record. And then I can get the credit that my patient got their colonoscopy. And so and this kept happening. People kept saying this, and I kept explaining the problem was technology, right? And then they said they were going to, hire someone to be in charge. And I was like, well, are they going to upload these documents for me? Because just hiring another person to tell me to do this isn't really helping.
It was like at one point in time in the early, not so early, but in the electronic medical record system, it kept saying people were smokers. And I was getting call after call after call from my patients saying, Dr. Novatt, I'm not a smoker, but yet my chart reads that I'm a smoker. And I'm like, I know. I don't know how many calls I've made about this, but for some reason, despite, Optum being a humongous company, no one seems to know how to fix this. Matt, we should have hired you. The producer of the show knows a lot about IT. Yeah. So what do you think is the way to fix this? I mean, so SUNY, colleges have figured something out. How is it? I mean, I apologize. We're not comparing apples to apples, but I guess just on a gut level and an intellectual level, what do you think might be the answer to the chaos? I mean, does it take a killing? That's the question.
I know. And I think about what you said earlier about, of course, I never endorse violence, but what I really regret is that we're not spending the time talking about the problem that led to this horrific event. Like there's a family missing their father. What happened that caused this and how do we fix this instead of just blame one individual? Like, how fair is it that guy carries the brunt of a system that we know has been leaping along since way before the pandemic?
That's right. What drives someone to the point at which, if you will, there was so much focus on where this gentleman came from, and in spite of having money and access, that he resorted to this. Well, let's ask why. Was there chronic pain that drove this young man to a state of, to this state? And what about that?
Yeah, what happened in his life that drove him to that decision?
Right.
And should we be worried about this? Because if he did this,
that's right.
Are there other people feeling the same way? And I think we all know the answer to people's unhappiness with what they're experiencing.
Right. Yeah, there's been so many memes about this, and one of them is, the response from all the other insurance companies is that they're just going to build bigger walls and higher security.
I know, more healthcare expenses.
That's right. That's right. Yeah.
Yeah, fixing the problem is, it's such a complicated issue. We know that over 30% of healthcare expenditures go to insurance companies. So there's this middleman who's managing, decisions that doctors and patients are trying to make together as a team. Can that be minimized? Some people estimate that, up to 30% of healthcare expenditures are in administrative costs. And, there's a large percentage of that that's thought to be wasteful. There's a lot of money to be made, especially in the boardroom part of healthcare. Certainly physicians are not hard up for cash, right? And I'm not trying to say that we're suffering, but we're not making pennies compared to what some of these people at the top are pulling in annually. And then you got to ask yourself, do they need to make that much money?
Really good question. I mean, most of the articles I read about the CEO who was killed was that he was making $10 million. They failed to really respond to the fact that I think he made close to $24 million out of benefits and perks and other wheelings and dealings.
I imagine it had to have been much more because even, CEOs of these smaller hospital organizations make about that much.
That's right. Yeah. That's right. Yeah. And it's, I'm sure these jobs are tough, but I kind of feel like we work really, really hard.
We work really hard.
Yeah.
And I think it's hard too sometimes because you care so much about your patients. You're fighting a system that feels at times like it doesn't care. And then the patients also get, like, at least in my case, they would get angry at me.
Yeah.
And I think a lot of that is because they don't know who to be angry at.
That's right.
They're sick, they're scared, their family member is sick, they love their family member. And who can they, unleash this on? And often the doctor is like the face of the healthcare system and faces the brunt when they really often can't change much at all about what's happening other than try to fight.
Yeah. I actually think that the two hardest positions in corporate medicine today on the ground is the front desk person.
Oh, those poor people.
And the clinician. Because, and I don't blame patients. I'll say, well, please call the billing number. And they'll say, I called the billing number, and the billing number gave me another number and another number. Like, everyone punts the ball because, one, either no one knows the answers because it's such a big corporation, or two, nobody's willing to take a risk on saying it happens like this. I mean, no one takes responsibility. So of course we're going to hear it. I mean, I got to a point where people would come in and they'd complain so much about the experience they had from the moment they walked in the door or how to get an appointment, et cetera, et cetera. And I'd say, you know what? We're here to take care of you. And you're preaching to the choir. I totally agree with everything you have to say. And I'm powerless. I used to own my own practice where literally my receptionist, my nurse, and me knew everyone. Any complaint, and thankfully there are very few, but any complaint was addressed by all three of us, first name basis. And what a joy that was, because it felt so much a part of caring for someone.
Yes.
And it feels so far, far from that.
Yes, the anonymity is also disheartening. And I think we all, even as physicians and I think as patients, it's a shared feeling.
Yeah. Yeah. So for all of you out there who are feeling frustrated, and I rarely come across someone who's not frustrated with the allopathic system, we're here to support you and hear you and understand your laments, because it's a really tough time. And I truly hope that we figure it out, because people are, I want people to be healthy, and people are sicker than they've ever been before. So not only is the system sick, but individuals are sicker than they've ever been. Can we talk a little bit about the amount of chronic disease there is out there right now?
Yeah, I mean, that's also a bit of a frightening topic. In some estimates, the millennial generation may be, one of the first generations in recorded history to have a lower life expectancy than the generation before them. And a lot of that has to do with some of these healthy choices that people are making early in life. Access to nutritious food, access to minimally processed food, the increased amount of sugar in our diets. Certainly sugar is a huge player in the health of America today. And it's hard to make change. There's some really interesting organizations locally that are trying to bring farm fresh food to the schools, we have all these farms in our area, which is so wonderful. And they're, trying to bring these opportunities to, economically disadvantaged kids that live in places where they can't get to healthy fruits and vegetables easily. So I think locally we have some really interesting things going on, but that's also hard to change.
Yeah. Yeah. Again, these are big industries across the board, whether it's who's providing our food, who's controlling the meat industry, big pharma, et cetera, et cetera. So it's really, it feels very daunting at times.
And it's hard to compete. Like if you're on a really restricted budget, it's hard to compete with the Arizona iced tea company that's giving you a big can for 99 cents. And like, that's going to buy you a lot less vegetables.
Yeah, exactly. But, so it's tough on many levels how to help people be healthy, remain healthy, pursue health, particularly in the younger cohort that you're seeing. But are these kids, are they, at least at SUNY, at New Paltz, do they feel more informed about some of these things than you think maybe our cohort in college? I mean, no one in my college days talked about nutritious eating. All they talked about was how many rolls they could put on their plate at the
dining hall.
Yeah. Thank you.
Yeah, no, it was definitely a different conversation back then. But it's like it's things have changed, right, since we were their age. But I think the current generation, that like college-aged cohort, they're much more informed, and I feel hopeful actually, because their access to social media, while there are drawbacks to what social media can do, there's a lot of benefit too, and they seem to be very educated about healthy food and exercise. So I feel hopeful that there's opportunity for people to have better health in the future, but something does need to change, because like we were talking about with rising healthcare costs, if we have increasing illness, how will we pay for that? How will we keep people safe? And, certainly one of the frustrations that I had come upon in primary care was with the limited resources I had, my own personal time, the time I had with each patient at each visit, and the, different changes that needed to be made to keep them healthy for the long term. I felt like all my visits became so much problem-based as opposed to helping them live healthy.
Yeah. You just mentioned the issue around personal time. So it's certainly something that Gynocurious has explored with other clinicians insofar as how to reconcile the demands of our work, what we want to give to it. We feel so passionately about serving and providing care, but then finding time for self-care, finding time to see family. You mentioned how getting to be a physician is not an easy trail. I remember, being in medical school and residency, and all of my peers, my friends from colleges were making lots more money, that's for sure.
Right.
They certainly didn't know what a 90-hour work week looked like, 100-hour work week, being up 5 days in a row. I mean, none of that stuff, right? So it takes a certain level of craziness to go there. But as a more mature clinician, and your kids are still younger, how did you? I mean, what was the incentive to make this change, I guess? And was it more about the personal or the professional, or both, so to speak?
I mean, for me, it was both, right? It was years of fighting a system that I had frustrations with, and then I just couldn't compromise on the care that I gave. Like, if I was going to take care of someone, I needed to do everything I could to make sure they, didn't have cancer if I was worried about it, or got that medication that I knew was going to help them, or, whatever it was. And ultimately, in my particular case, what I was doing was that I was getting up every morning at like 4:30, and I was doing all this like outside the office work before my family got up, so that when my family got up, I could be present. And then I would, go to work and try to fit in as much as I could. And then I was like sneaking away. Like my kids would be at baseball, and I would be like sitting in the stands with my computer. And I'm sure plenty of parents have seen me there typing away, while my kids are like at a baseball game. And then, so I was trying to balance all this. And then and I'm not trying to say that this was the reason that I left, but my mom passed away last year, about a year and a half ago. And I realized that I had told her for all these years that I couldn't come visit her. I was too busy. And could she come see me? Because I was having trouble balancing it all. And then I was like, I will never be able to tell her that I don't have time for her again. I didn't make the time. And then it suddenly became so clear to me that I was doing this to my family. I was totally sleep deprived, and I refused to compromise on the care that I gave. And so it became an all or nothing, and I had to leave.
Thank you for sharing that with us. And I'm sorry to hear about your mom. And it's so, I feel so much empathy, because I don't know how many times I have said, I'm sorry, I'm just too busy. Mm-hmm. And my kids are now adults and kind of all grown up. And I must admit, I feel a level of sorrow. I'm trying not to feel guilt, because that doesn't get me anywhere, but sorrow around how I had a hard time figuring out that balance. I had a hard time figuring out how to be a great clinician and a great parent. I failed at times. There's no question about it. And I've said to my kids, you often got the worst part of me. I'd come home at the end of the day and be totally exhausted. So what did I have to give? For all of you out there who might be pursuing medicine or practicing medicine, create boundaries, because corporate medicine will never do it for you. Never, ever, ever. They're just going to demand more and more. And again, we're really good at it. So we just keep doing and doing and doing. And after you've done a residency where you've stayed up night after night for a week, we have a muscle, if you will, that many others don't. So we just keep exercising it. I'll just do more. I'll just do more. So, it feels like it's not uncommon for loss, ill health to catapult us to a shift and change. So again, I'm sorry your mom's passing was part of it, but it sounds like it was just building up and building up and building up. So this new work, it gives you more freedom?
I mean, it's lovely when I
what a great word.
Because what I really want is just to take great care of other people. Like, I love being around people, and now I can be with them, and then I can go home, and on my way home, I can listen to a podcast.
Hint, hint, hint.
But I have some joy back in my life that I didn't realize I was missing. But I had so much other joy. And again, it's not I'm not trying to pity me. It's,
No. Yeah.
But there, and certainly, I think we can both commiserate on times that we felt sorrow for choices that we made. But, we also modeled what it was like to be a caring human in a world that sometimes feels like it doesn't care.
That's right. That's right.
So,
and also to feedback on my kids are able to say now, we admire what you do. Yeah. And that was important. They admit there were times they wish I were around more, but it's I think parenting is a very hard journey, and we all do our best. And in today's world, where if you are in a couple, most couples are both, most people in a couple are both working by the nature of the costs of living. And I want to make sure it's really clear that Amy and I are not pitying ourselves. We're so privileged, and we're well paid, and we chose this profession. But I do think that the kind of the illness, if you will, of this system has affected clinicians and patients alike. And that's what we're here to talk about, is just making sure that the audience, hears from us too, and knows that we're thinking about you, and we're trying to figure out how to make it work. Yeah.
Yeah. And, it's interesting. Yeah, we're trying to make it work. I mean, I used to tell, some of the people that I worked with, I was like, we're the good guys. Like, we're trying. Like, it may not feel like that. And I think it's important that patients know that, like, their doctors and their nurses and their front staff that they're interacting with, they all have those jobs because they care about people. And so just, that understanding that these humans chose these jobs because they care, I think can help people feel a little bit better when they do have to interact with the system. But, obviously the system needs to change. And just one other thought I was, thinking when you were talking about our privilege, that it is a privilege to have had this, journey in our lives. But one other thing that I started seeing over the last few years, a lot of my patients were doctors and nurses and healthcare providers. And they would come in and they would talk to me about the same feelings that we're talking about right now. And so there's sort of this whole discussion in healthcare research, I guess we could say, about moral injury.
Yeah.
And, it's an important thing that, the system needs to do something about that too.
Yeah, we've talked about it on Gynocurious, but can you speak a little bit more about that as we come to an end? Like, what does moral injury mean to you?
I mean, I guess it's, it's the feeling that because of systemic challenges, you can't do the job that you feel destined to do. And I think for a lot of doctors and nurses and, healthcare providers and clinicians, if you can't do that, a lot of people do reach a point where they can't continue on anymore. Their internal ethics have been compromised.
Yeah, exactly.
That's a hard battle.
That's a very hard battle, to go in and day out and feel like you're not doing good work you want to do.
Mm-hmm.
And that every turn there's an obstacle to doing your best. Yeah. So when you're not working, I like to talk about pleasure. What do you do to give yourself pleasure?
I mean, I've always been a big outdoors enthusiast, and so I'm grateful to have a bit more space in my life now to be able to enjoy the beauty of our Hudson Valley and experience our beautiful local farms and get involved in community activities that do focus on health and prevention and in a way that I really enjoy.
I think I read you're part of like the Dutchess County Health Board.
A Board of Health,
Board of Health.
Mm-hmm.
What is that? What does that work entail?
So the Board of Health tries to help influence policy in relationship to the health of our county. Mm-hmm. And every county is different and has different health objectives. And so, we have an amazing commissioner who's really dedicated to promoting the health of all our different variable communities in Dutchess County. And she's been working on a lot of initiatives with this sort of farm to school movement. They've been working on, we were exploring at our last meeting, are there incentives that we could do to help businesses offer more diabetes-friendly menus, as opposed to changing laws, which is harder to do, but are there incentives that we could focus on to help, influence the health of our community? But sometimes they do talk about, we have doctors, we have community members, we have legislators, a whole variety of people on the board to try to help grow the community.
Great.
Yeah.
Well, thank you for that work.
Yeah, love it.
So I want to just thank you for joining me today. It's been really a pleasure.
Thank you for having me.
Yeah. And may you have plenty of time to get outdoors despite this very cold weather. And happy New Year.
Happy New Year.
Yeah. And thank you to my co-producers, Jen Hammoud and Matt Rosenberg. Thank you to the Epicurean for having us here. Until the next episode of Gynocurious next week, please stay well. Listen to your instincts and intuitions. They are the greatest of teachers, not to be ignored.